Hello, my name is Paige Thompson, and I am a physician assistant student at the University of Pittsburgh. This video is a part of a series on blood pressure that I'm doing with the help of my classmate Sarah Ryland and in collaboration with Valerie Wan, who is a student in the School of Pharmacy. In this video, I'm going to go through 6 lifestyle modifications to help lower your blood pressure. Before I start, I want to clarify that this video is just about making lifestyle changes. However, it is best to work with your healthcare provider on an individual and regular basis to determine the best treatment plan for you. Another video in this series covers common blood pressure medications, but as always, please contact your healthcare provider for any questions regarding your medications. The following slides are in no particular order, and implementing any or all of them will be helpful to lower your blood pressure. With that being said, let's get started. The first way to lower your blood pressure is through exercise. Regular exercise is encouraged for everyone, and it is a great way to lower your blood pressure. Examples of activities that you could complete include walking, jogging, dancing, swimming, riding a bike, or using an exercise machine such as an elliptical. There are different weekly goals depending on the type of exercise that you complete. Moderate intensity exercise like walking should be completed for a total of 150 minutes per week, or 30 minutes 5 times per week. For vigorous intensity aerobic exercise, the weekly goal is only 75 minutes, or around 30 minutes 3 times per week. A good way to distinguish between moderate intensity and vigorous intensity exercise involves your ability to speak. If you can talk and maintain conversation, it is more likely a moderate intensity exercise, like a nice walk with a friend. If you can say no more than a few words without pausing to take a breath, it is more likely a vigorous intensity exercise, like a brisk jog. As always, consult with your healthcare provider if you are concerned about starting an exercise regimen. A second way to lower your blood pressure without medication is by adhering to a healthy diet. In particular, the Dash Diet, which stands for Dietary Approaches to Stop Hypertension, is particularly helpful in lowering blood pressure. This diet was developed during the Dash trial and is now a standard of blood pressure treatment and education. The Dash Diet is rich in fruits, vegetables, legumes like beans, peas, or lentils, and low-fat dairy products, while being low in snacks, sweets, meats, and saturated in total fat. The result of this study showed that in just 2 weeks, participants had a lowered blood pressure following this diet, and they were able to maintain this over the next 8 weeks of the study by continuing to follow the diet. If you are interested in learning more about the Dash Diet, this link from the NIH, or the National Institutes of Health, is an excellent resource to explore this diet plan further. It has great information on how to get started and examples of meals that you can make that comply with the Dash eating plan. If you're interested, please Google NIH Dash eating plan or click on the link which is on the Wellness Center Facebook page or website to get started. The third way to lower your blood pressure without medication is to decrease your daily sodium or salt intake. According to the American Heart Association, their recommended salt intake is 1,500 milligrams per day. However, the National Health and Nutrition Examination Study showed that the average daily salt intake by Americans is 3,600 milligrams per day. Most of our excess salt intake comes from restaurant food and prepackaged foods. This is why it's very important to read your food label to check for added salt. In addition, over 100 different studies have concluded that lowering sodium intake reduces blood pressure. The link at the bottom of the slide, which can be found on the Wellness Pavilion's Facebook page, takes you to an article talking about the sodium in your diet and different things that you can do each day to lower your sodium intake. We're going to go through a few of those here. First, I wanted to go over one popular example to demonstrate how common it is to have added sodium in foods. The example I chose is Campbell's chicken noodle soup. So on the left side of the screen, there is a nutrition label for 1 can of the regular version of Campbell's chicken noodle soup. This has 890 milligrams of sodium. which is over half of the American Heart Association's recommendation of 1,500 milligrams per day. So this shows how easy it is to consume extra sodium in prepackaged foods. However, choosing the low sodium option of your favorite foods can help to lower your daily intake. On the right side of the screen, I have the low sodium version of the same chicken noodle soup from Campbell's, and this only has 120 milligrams of sodium, which doesn't take up too much of the 1,500 milligram daily total. Now, if you're used to a diet that has a lot of added salt, quickly changing to low sodium options will take some time to get used to. It has been shown that it takes approximately 6 to 8 weeks for your taste buds to adjust to less sodium in your diet. So if this is a measure that you would like to adopt to lower your blood pressure, it's important to be patient and give yourself some time to adjust to this. Other strategies to help you decrease the sodium in your diet include trying to use seasoning blends without salt, like the Mrs. Dash seasoning blends seen on the screen here. Also, purchasing fresh meat, fruits, and vegetables and seasoning them yourself will lead to less salt intake. If you buy canned vegetables, it is recommended to rinse these vegetables in water before eating to drain the excess salt that they are preserved with in the can. And finally, making a habit to read food labels to check for added sodium, purchasing low sodium or reduced sodium versions of foods, and limiting restaurant and fast food options will all help to lower your daily salt intake. The fourth way to lower your blood pressure includes limiting your alcohol intake. To the left of the screen, there's a diagram showing the standard drink sizes for alcoholic beverages. This is a useful tool to utilize when calculating your own alcohol use per day. So according to the chart, 12 ounces of beer, 8 to 9 ounces of malt liquor, 5 ounces of wine, and a 1.5 ounce shot of liquor all separately count as one drink. Limiting alcohol to 1 drink per day for women and 2 drinks per day for men is shown to decrease blood pressure. So this is a useful tool to make sure that you are at or under that daily goal in order to keep your blood pressure from elevating due to alcohol. The fifth way to lower your blood pressure without medication is by quitting smoking. Tobacco acutely raises your blood pressure and is most pronounced during the first cigarette of the day. So, nicotine is the addictive substance in tobacco products, and the use of a cigarette increases your nervous system activity, which raises your heart rate and blood pressure. So, when a cigarette is used, this can elevate your blood pressure as high as 20 millimeters of mercury higher for the first 10 to 15 minutes after a cigarette use. This happens each time you use a cigarette, so smoking throughout the day repeatedly raises your blood pressure. Smoking is a leading cause of preventable death and major cause of disease. Therefore, talk to your healthcare provider for strategies, medications, and therapies to help you quit smoking. The sixth and final way to lower your blood pressure without medication is by losing weight. For every 1 pound lost, your blood pressure will decrease by 1 millimeter of mercury in those with high blood pressure. Weight loss on its own can provide these benefits, but weight loss can be achieved through exercising, limiting sodium intake, limiting alcohol intake, following the Dash Diet, and quitting smoking. Therefore, all of these strategies and ways to lower your blood pressure can work together to achieve this goal. Take this process one step at a time, and as always, ask your healthcare provider if you have any questions or if you want an opinion on what strategy may work best for you. Thank you for watching this video on 6 ways to lower your blood pressure without medication. This is a part of an educational video series on blood pressure. So if you're interested on what high blood pressure is and a little bit more on the background of why it's important, or if you're interested in blood pressure medications, you can access these other videos on the Wellness Pavilion website as well as the Wellness Pavilion Facebook page. Hopefully, we will be able to meet in person at the Wellness Pavilion in the Homewood Community Engagement Center soon. So thank you for tuning in, and hail to Pitt.